Hi class, this is your instructor, Skylar Huff. We're back here in the chapter 11, and let's get right back to it. We left off at the reticular activating system. As we are here, what I'll say about this RAS system is that when sensory impulses reach the reticular formation, it responds by activating your cerebral cortex into a state of wakefulness. I say this because without this arousal, our cerebral cortex would remain unaware of stimulation and cannot interpret sensory information or carry on thought process. I'll be blunt. Decreased activity in the reticular formation results in sleep. If in fact the reticular formation is injured or ceases to function, the person remains unconscious, even with strong stimulation. This is when they are, of course, called comatose. So I'm saying all of this because it's scattered, meaning the reticular formation is scattered through the medulla oblongata, the pons, and midbrain, and it's a complex network of nerve fibers that are associated with tiny islands of gray matter, called the reticular formation. Now to types of sleep. I'll be here at sleep rather briefly. So sleep is a normal, recurring, reversible state of unconsciousness. I say again, it's a normal, recurring, and reversible state of unconsciousness, and is characterized in part by limited sensory input and inhibited by muscle activity. There are two types of normal sleep that exist. It's called non-rapid eye movement sleep, or non-REM, and of course, rapid eye movement sleep. Non-REM sleep occurs when a person is very tired and reflects decreasing activity of the reticular formation. It is restful, dreamless, and accompanied by reduced blood pressure and respiratory rate. Non-REM sleep may range from light to heavy and is described in 3 stages. The third stage is known as slow wave sleep. It may last from 70 to 90 minutes. So non-REM sleep and REM sleep, they alternate. So REM sleep is called this paradoxical sleep because some areas of the brain are active. As its name implies, the eyes can be seen rapidly moving beneath the eyelids. Cats and dogs in REM sleep sometimes twitch their limbs, and in humans, REM sleep usually lasts from 5 to 15 minutes. This dream sleep class is important. If a person lacks REM sleep for just one night, sleep on the next night makes up for it. During REM sleep, heart and respiratory rates are irregular. Certain drugs, including marijuana and alcohol, such as the benzodiazepines, interfere with REM sleep. So now on to the cerebellum. Here at the cerebellum, it is a large mass of tissue that is inferior to the occipital lobes of the cerebrum, and it is dorsal to the pons and the medulla. Having said it this way, it consists of 2 lateral hemispheres partially separated by a layer of dura mater called the falx cerebri. A structure called the vermis connects the cerebellar hemispheres at the midline. So as I continue with the cerebellum, I'll say the cerebellum integrates sensory information concerning the overall position of the body parts. It coordinates skeletal muscle activity and maintains posture. It even receives sensory impulses from receptors in muscles, tendons, and joints, proprioceptors, and from the special sense organs such as the eyes and ears. So damage to the cerebellum can cause a specific type of tremor. This tremor, the cerebellar tremor, has inaccurate movements of voluntary muscles and loss of muscle tone and even an uneven walk and loss of equilibrium. Continuing on now. Right before I get to what is next, excuse me, I completely forgot about changing where I was with the presentation. I'm sorry about that, class. So as I was at the cerebellum just a moment ago, you see that now. If you need to see more of this, please click pause. So the brain review is here for you. Please use it. It's called Table 11.5, and even sleep disorders. If I were you, I would go through those sleep disorders, such as I'll go with narcolepsy and insomnia, and even obstructive sleep apnea syndrome. At least read through those to review. The last thing I'll say before moving on to what's next is to please ensure that you review Clinical Application 11.4 with brainwaves. Brainwaves. I say that because it's important to know about brainwaves, and particularly those alpha waves, which are regularly and rhythmic, called idling brain, a calm and relaxed state of wakefulness. The beta waves, which are also rhythmic, but less regular than alpha waves, as when you are concentrating on working a problem or concentrating on a visual stimulus. Up next would be the theta waves, which are more irregular. These are more common in children, and the theta waves are uncommon in the awake adult, but may appear when we are concentrating. And then lastly, the delta waves, which are high amplitude waves seen during deep sleep and when the reticular activating system is suppressed, such as during anesthesia. And if in fact in awake adults, that indicates brain damage. Please review those brain waves with the clinical application UL. There they are before you: alpha, beta, theta, and delta waves. So here are the sleep disorders I said you all are to review. In the essence of time, class, I'll keep on going. So I've now moved over to the cerebrovascular accidents, meaning this would be a disorder class, or at least a brain injury with a disorder. So in case it's not yet obvious, I'll put it as being that brain injuries and disorders have devastating consequences. We've already done traumatic brain injuries. What we'll now do is learn more about cerebrovascular accidents. Cerebrovascular accidents are the single most common nervous system disorder and third leading cause of death in North America. To help you out, class, this is on your test. If I were you, I would make sure I am taking the most of notes now. Cerebrovascular accidents can also be referred to as strokes. So cerebrovascular accidents, also known as strokes, they occur when blood circulation to a brain area is blocked. Thereafter, the brain tissues die of ischemia. To help you out, ischemia is nothing more than that reduction in blood supply that impairs oxygen and nutrient delivery. The most common cause is a blood clot, blocking a cerebral artery. So that blood clot may originate outside the brain, such as in the heart, or form on an interior wall of an arteriosclerotic brain artery. I'm saying this because it's important to know. Please take notes. If in fact the blood clot is a clot that does not travel, meaning the blood clot stays in some arteriosclerotic brain artery and it did not travel elsewhere, it will be known as some form of a thrombus. However, the blood clot that happens to travel, such as one that did not originate in the brain, being outside the brain, and then moved to the brain, would be called an embolus. So the embolus is the clot that moves, as opposed to the clot that does not move, being the thrombus. So many survivors of cerebrovascular accidents experience hemiplegia, which is paralysis on one side of the body. Along with it, it very well may not just be this major stroke or this massive stroke. It could have been a transient ischemic attack, known as the TIA or TIAs, transient ischemic attacks. These are temporary episodes of reversible cerebral ischemia. And I say temporary because they can last anywhere from 5 to 50 minutes. A person experiencing such may experience temporary numbness. I'll continue. With this, paralysis or impaired speech may also be experienced. So, since it's said to be temporary or even transient, it is not permanent. It is a warning of likely an impending cerebrovascular accident, an impending stroke. This is on your test. So to treat a stroke, I would say the only approved treatment would be that tissue plasminogen activator, the TPA. It is that most successful treatment for strokes. What it does is dissolve the blood clots in the brain. However, the key here is it must, and I repeat, the key is that it must, I want to say it again, the key class is that it must be administered within 3 hours from the onset of symptoms. Beyond 3 hours, it cannot be used. As you all become nurses, I'll tell you that you should use the NIH stroke scale scoring sheet. 0 is the best, 42 is the worst. If this were in class and we were there together, I would pass this out for us to review. In the meantime, I shall now continue. As I continue, sometimes what can be used or what has been used is called the Cincinnati scale. First things first, before I get there, to interpret this, it says patients with one of these 3 findings as a new event have a 72% probability of an ischemic stroke. If all 3 findings happen to be present, the probability of an acute stroke is more than 85%. First things first, facial drooping. If a person has a smile or can show his or her teeth, and if one side does not move as well as the other, meaning seeming to droop, that may very well be a sign of stroke. Arm drift. Have him or her hold those hands, meaning, of course, have them hold those arms out in front of their body for about 10 seconds. Now look closely to see if one arm does not move or if one arm winds up drifting off downward than the other, more than the other, and that too could be, of course, a sign of a stroke. Thirdly, class speech. Have the person say, "You can't teach an old dog new tricks," or something that's, of course, otherwise simple and familiar. And if the person slurs those words or gets some of the words wrong or is just unable to speak, that is most definitely what could be a sign of a stroke. Lastly, of course, check for the PMS, pulse, motor, and sensory. I say this because the pulse, meaning is there a pulse there or not? Assess for the absence of presence. Next up, motor. Ask him or her, can they wiggle their fingers or toes? Motor. Lastly is sensory. So please pinch the skin near the pulse point or even squeeze a finger or even a toe and ask him or her if they can identify where they are being squeezed. I'll move it on. So briefly here, I'll get into the spinal cord and I will not be here a very long time, class. Here at the spinal cord, what you all should know is that we have pairs. I repeat, we have pairs, meaning it's a slender column of nervous tissue that is continuous with the brain. It extends downward through the vertebral canal and it begins, class, at the foramen magnum of the skull. And then it terminates at the first and second lumbar vertebrae. So there are 31 segments giving rise to a pair of spinal nerves. The spinal nerves are grouped according to the level of the vertebra with which they are associated. So let's continue on. So there is the cervical enlargement, the lumbar enlargement, the conus modularis, the filum terminal, and the cauda equina. This is a spinal cord cross-section that you all will see in lab. 2 main functions of the spinal cord. A, it is the center for spinal reflexes, and B, it's that pathway for impulses both to, class, and from the brain. So, that is the spinal cord. I'll do more with the spinal cord hereafter, but in the essence of time and knowing where your studies should lie, not to say the spinal cord is not as important. However, we must move on to what I do know that a lot of information will come from on your lecture test, being the final exam. So as I move on over, I have now turned in my textbook to page 428, section 11.7 with the Autonomic Nervous System. Again, I said this is on page 428, section 11.7. And as a prefix to this, I'm going to drive back a little bit. I'm not literally driving, but I'm going to go back just a bit to section 11.6 for just a moment. And the reason I'm doing this is because I know what's going on the test. Here it is on page 417. Briefly, I will begin. Page 417, section 11.6. Let us begin. So the peripheral nervous system, it has nerves that branch from your central nervous system, and of course they are there connecting it to other parts of the body. In other words, the peripheral nervous system has cranial nerves. They go from the brain, and there are 12 pairs of cranial nerves. Of course, we have the peripheral nervous system by way of the spinal nerves, which of course I just mentioned earlier on, and they connect at the spinal cord. Now we have two further divisions, and they are known as the somatic nervous system, with those nerve fibers that connect the central nervous system to the skin, and skeletal muscles. Keeping in mind that, of course, the skeletal muscles are voluntary under conscious control. Nextly is the autonomic nervous system, which is where we're about to go. The nerve fibers here, they connect the central nervous system to the viscera. In other words, the heart, stomach, intestines, glands. These, class, are involuntarily controlled. And of course, subconscious. With that preview now, I'm going back over to 11.7. Hope you're taking notes and taking notes well. I'll now begin. The autonomic nervous system. So it's that efferent or motor division of the peripheral nervous system. I did say efferent. So it's automatic. It functions continuously without conscious effort. Visceral activity is regulated via smooth muscle, cardiac muscle, and glands. I am giving you exactly what to know for your test. And not just your test, but this is what you must know to, I say, do well. I'll continue. So it controls things such as heart rate, blood pressure. In addition to heart rate and blood pressure, I'll say breathing rate, body temperature, and others which maintain homeostasis. In saying such, even at emotional stress, I repeat, even at emotional stress, and to prepare the body for physical activity. So it's under hypothalamic control. I'll say again, it is under hypothalamic control. And as I say that, the hypothalamus is what controls it. So it happens with reflexes from sensory receptors in the viscera and skin. So with this, we have two divisions. If you have pencil and paper, please prepare to write. With this, we have two divisions. They are the sympathetic division of the autonomic nervous system and the sympathetic division of the autonomic nervous system. I say once more, if you have pencil and paper, prepare to write. Right now, I have autonomic nervous system. As you see it, somewhere in the center of your paper, write it huge. And if you would like, turn your paper sideways. Please write autonomic nervous system. And of course, divide it in half. On one side, please write sympathetic division or sympathetic nervous system. And please write parasympathetic nervous system or the parasympathetic division. Let us begin. So as I do this, I'll say the parasympathetic nervous system promotes maintenance functions and conserves body energy. The parasympathetic nervous system, I say one more time, it promotes maintenance functions and conserves body energy. On the contrast, the sympathetic nervous system mobilizes the body during activity. I say again, the sympathetic nervous system is what mobilizes the body during activity, such as you going for a run. The role of the parasympathetic nervous system is to, of course, control us throughout rest and digest. In other words, it controls those maintenance functions and functioning during you as you are A, at rest, and B, as you digest. Hence, it's sometimes called the rest and digest system. In the contrast, I would say that the sympathetic nervous system, its role is fight or flight. Period. Fight or flight. So to get back to the opposite side, class. Upon eating a meal and reading a magazine, it is that parasympathetic nervous system that is in control. However, when we are excited, or in emergency or even threatening situations, such as someone breaking into your home, you are not going to be there with a body that's trying to digest that slice of pizza. The body will go through that fight or flight system with of course, a rapidly pounding heartbeat, a dry mouth, cold, sweaty skin, and even dilated pupils. That is the sympathetic nervous system. However, the parasympathetic nervous system, I say, is when your blood pressure and heart rate are regulated at low normal levels. So the GI tract, class, is actively digesting food, as I just mentioned. With your eyes, your pupils are constricted for close vision and accommodation. It's called the D, I repeat, D as in dog. It's called the D division. And here they go, class. Write these down. Digestion, defecation, and diuresis, which is called urination. It's called, I say, digestion, defecation, and diuresis. Urination. On the converse, the sympathetic nervous system is when we're at vigorous physical activity. So those visceral blood vessels go through constriction, shunting blood to the skeletal muscles, and vigorously working the heart. So the bronchioles begin to go through the process of dilation to increase oxygen delivery to the cells. So that sympathetic division is known as the E, as in eat. I say the E division. Exercise, excitement, emergency, and embarrassment. I'll now continue on. Please know those for your exam. So having done this, I'm moving on now to the system. So here, the parasympathetic nervous system, that fight or flight system, and now to that, I said the sympathetic nervous system, that fight or flight system, and that parasympathetic nervous system, that rest and digest system. So what I'll get to now, of course, will deal with those autonomic nerve fibers. I'll do this very briefly. Autonomic nerve fibers, they have pre-ganglionic cell bodies in the central nervous system. So as the axon leaves, the central nervous system, post-ganglionic would be, of course, as the axon extends to the visceral receptor. So you go from the pre-ganglionic is from the brain, leaving the CNS, and then those that are post-ganglionic is, of course, the axon that extends to the visceral receptor. So as you're looking here, class, it's showing you every bit of what I've stated. You have those that are pre-ganglionic, and of course you have those that are post-ganglionic. So I say the effect here is dependent on the receptor or effector. Effect here. It could be stimulatory or inhibitory. So I'll put it this way. In the somatic nervous system, the effect of acetylcholine, you see it there, class, being ACH, it is always stimulatory. But now that we've moved over to the sympathetic as well as parasympathetic nervous system, the effect is not the same. So I say again, it will be either stimulatory or inhibitory. It depends on, of course, the neurotransmitter that is going to be secreted and the receptor on the effector organ. Class, that is majorly important to know. I'll now continue. So what happens is we have dual innervation. I repeat, it's called dual innervation. I say it's dual innervation because all visceral organs are served by both divisions, but these divisions cause the opposite effects. That's majorly important, class, for you to know. For example, the sympathetic nervous system. It can indeed, class, increase heart rate and dilate your pupils. But of course, the parasympathetic nervous system will decrease heart rate and constrict your pupils. And I'll leave it at that, and I'll come back to a point I'd like to make in a moment. So I'm going to pause here for just a second, class, because what I'll leave off here, class, are those neurotransmitters, meaning it says it there in the center, neurotransmitter effect, and it shows you the two neuron chains from the CNS to affected organs. I'm saying this because the neurotransmitter of the autonomic nervous system can be called cholinergic fibers, which of course are there secreting acetylcholine. I say again, cholinergic fibers are there which secrete acetylcholine. And that deals with the parasympathetic post-ganglionic axons. You can see that right here. Parasympathetic post-ganglionic fibers secreting their acetylcholine. And then we have those adrenergic fibers which secrete norepinephrine. I repeat, we have those adrenergic fibers which secrete norepinephrine. So I say this because it's, well, there. And along the way, it will be those sympathetic post-ganglionic axons, except those that secrete acetylcholine. So I say it is those except those that secrete acetylcholine. Now, that except is here because it deals with that adrenal medulla. And it's going to be along the way with epinephrine as well as norepinephrine there too. So it says, what are the effects? The effect class is receptor dependent. It's not one size fits all. So I've done roles already of each of these systems. This class is that T-chart you all just made. If you check it, please pause now and check it. And this will be the role of the sympathetic nervous system. And if I say again, if you need time to redo this, please go through it yet again and press pause. Because I didn't mention, of course, the secretion of glucose, or at least the release of glucose or the shunting of blood to skeletal muscles and the heart. You gotta have those, class. You gotta have those. So this just shows those key anatomical differences between the autonomic nervous system as well as the parasympathetic and, of course, sympathetic divisions. I say again, this shows those key anatomical differences between the parasympathetic and sympathetic nervous systems, which, of course, are grouped within the autonomic nervous system. So as you see this here, it shows you where the fibers originate. In other words, the parasympathetic nerve fibers, they originate, class, in the brain stem or in the sacrospinal cord. To contrast, the fibers for that sympathetic division, they originate in the thoracic and lumbar spinal cord. So this is anatomical differences, class, showing you where they originate. So I'll now move it on over, now that you've done that. So I'll pause here for just a moment. The reason I pause here is because the vagus nerves, this is the 10th, I say again, the 10th cranial nerve. The vagus nerves, I pause here for very important reasons, you all. They account for 90% of all preganglionic parasympathetic fibers in the body. So they serve all of our thoracic and abdominal viscera. This, of course, includes what's right in the abdominal pelvic cavity, you all. And then, of course, that is in the thoracic cavity. The preganglionic fibers arise from the medulla, and they synapse in the terminal ganglia in the walls of those target organs. To make it most specific, class, this is what I'm saying. We have what is called the cardiac plexus. We have what is called the cardiac plexus. You'll see a photo here in a moment. It slows your heart rate. Notice, class, this is the cranial part of the parasympathetic division. The pulmonary plexus, it serves, class, both the lungs and bronchi. And then the esophageal plexus, class, it forms the anterior and posterior vagal trunks, i.e. serving, class, stomach, liver, gallbladder, pancreas, small intestine, and part of the large intestine. Class, this is what makes us who we are. And they say it's the rest and digest nervous system. So you're seeing, class, all of which that I just mentioned. Moments ago, class, I said those key structural differences or those key anatomical differences. Hello, here it is. Notice where they begin. They begin, class, They begin, class, here in the brain. Notice, as we leave the brain, class, I'm going to go down, 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 and find, here it is, cranial nerve number 10. That's the vagus nerve class going down. I'm still going down. Up, here we go. A, the heart. The cardiac plexus. The pulmonary plexus. B, the lung. C, liver and gallbladder with the celiac plexus. I'll continue on, class, but I will stop. This class is very important to know because this is what, of course, as I just mentioned, class, slows your heart rate, serves the lungs and bronchi, and of course, innervates, class, stomach, liver, gallbladder, pancreas, small intestine, and part of the large intestine, the rest and digest system, I call it, by way of, class, the vagus nerve. Now on to that, of course, the sympathetic division. Notice, class, here they are, from T1 class to L2, thoracic to lumbar, class. This is where it begins. And looking at here, class, it's serving, but it serves, class, in a different way. I told you, if they break into my home, class, I highly doubt I'll be thinking, class, of digesting the hamburger I had for dinner tonight and french fries. It will not be happening. It will shut off this and, of course, go to the fight or flight by way of the nerves shown here. So it says pathways that synapse with the adrenal medulla, class. So upon stimulation, the medullary cells secrete norepinephrine and epinephrine into the blood. So as it happens, class, it'll be called noradrenaline and norepinephrine. In other words, class, this is, of course, the adrenal medulla is that misplaced sympathetic ganglion. It's different, class, in the way it operates. It's different, class, I say again, in the way it operates. That's why I mentioned earlier, class, epinephrine by the adrenal medulla. So since I'm here, class, with what is different, please make a note. Please make a note. I haven't quite gotten to what I want to get to, but this class with the adrenal medulla reminded me. Only innervated by, class, our sympathetic nervous system. I repeat, I have 3 parts, 3 places. 3. Here we go. They are sweat glands, are only innervated, class, by that sympathetic nervous system. The erector pili muscle, class. I say again, the erector pili muscle, class. You should remember this, class, from your skin test. Is only innervated, class, by the sympathetic nervous system. And thirdly, class, and I even say more importantly, smooth muscle in the walls of all arteries and veins. This is majorly important to know. So again, I say there are 3 organs, class, that are only, I say only, innervated by the sympathetic nervous system. Again, they are sweat glands, the erector pili muscle, and smooth muscle in the walls of all arteries and veins. Class, you should write that down, I would say at least 4 times. It's important to know. You'll hear about this again, class, in cardio by way of anatomy and physiology too. I'll now continue. So next to the visceral reflexes, class. This will be on your test. It's called the reflex arc. You saw it in your last test too. You have that receptor, class, and of course, this is review along that sensory neuron class to the integration system by way of the motor neuron class and eventually to the effector. And what I'm getting to now is there are 2 differences, class. 2 differences between visceral and somatic reflex arcs. The visceral reflex arc has 2 consecutive neurons in the motor pathway. And of course, they send information, class, about chemical changes, stretch, or even irritation. In other words, the example of a visceral reflex would be, of course, reflexes that empty the rectum and bladder. You know when you have to go. And I'll leave it at that. You know when you have to go. This class shows that visceral reflex. So on your test, look for a question that asks about what you see here. Stimulus, the receptor, class. And of course, by way of that, start again, Huff. Okay. Stimulus, class. From that stimulus, we have a receptor. The receptor is here, and it moves, class, that information along this sensory neuron. We get to the dorsal root ganglion, and eventually, class, here into the integration center. From there, class, there might be, of course, an interneuron here, and it may not be. And at any rate, we continue on by way of a motor neuron. And after the motor neuron class, we'll enter into what is called the autonomic ganglion. And then, of course, it may very well be class some visceral effector, then getting us to our response. So there it is, class. The visceral reflex. All right, neurotransmitters, class. Again, I say I hope you're taking really good notes. Otherwise. So here we are, class. So we have major neurotransmitters of the autonomic nervous system. I say again, they are acetylcholine, class, and norepinephrine. Having done this, what I'm saying now is that acetylcholine is released, class, and it's released by what are called cholinergic fibers. So it happens at all autonomic nervous system pre-ganglionic axons and at all parasympathetic post-ganglionic axons. We'll do more of this in a moment. Norepinephrine, class, is released by our adrenergic fibers at almost all sympathetic post-ganglionic axons except those at sweat glands. Those release acetylcholine, and I just gave you a hint as to why, because those are all going to be innervated, class, by the sympathetic nervous system. Hint, hint. So the effect, class, of the neurotransmitter depends upon whether it binds, class, to either A, cholinergic receptor, or B, an adrenergic receptor. And that's where we're going now. Let us begin. So we have two types of cholinergic receptors that bind to acetylcholine. And in case you're wondering, class, they are named for the drugs that bind with them. So we have those nicotinic receptors. I say again, those nicotinic receptors, they bind with nicotine. And we have the muscarinic receptors, which bind, of course, with the mushroom poison class called muscarine. I'll keep going, class, being with the nicotinic receptors. So the nicotinic receptors, class, always are stimulatory at the neuromuscular junctions. You all should know about those. We did this, class, just last chapter, and chapter what is called 9. You learned about the neuromuscular junction, class, and the effects thereafter, and you explained on your test. Secondly, class, it'll be at the adrenomedullary cells. This should make a bit of sense, class. And then lastly, it says the sarcolemma class of skeletal muscle cells at the neuromuscular junction. Boom. So the effect, class, of acetylcholine at the nicotinic receptors, class, is always, always, always stimulatory. There you have it. It opens, class, those ion channels, depolarizing, class, the postsynaptic cell. So now to the muscarinic receptors. So the muscarinic receptors, class, are going to be all parasympathetic effectors. So the effect here is excitatory, class, or inhibitory. That effect, class, depends on the receptor. In other words, I have an example here. If in fact, class, happens to be acetylcholine, class, at cardiac muscle, it slows down heart activity. However, class, acetylcholine at smooth muscle of the gastrointestinal tract, it increases, class, motility. Class, this is why it's so important, you all, to know this information. Because one day in the clinic, you will need to use this. No, I'm sorry. A lot of your days. Many days, class, in the clinic, you will need this. Up next, class, we get to the adrenergic receptors. So with those adrenergic receptors, class, they bind with norepinephrine, class, or epinephrine. And I'm sorry about the presentation here. They have checks and bicycles. To help you out, class, my check marks aren't check marks at all. Those should be alphas. A-L-P-H-A, alpha. Let us begin. So the alpha receptors, class, are divided into two subclasses. Let us begin. So they're called the alpha 1 and alpha 2 subclasses. So with that, class, what happens here is the effects, class, will be either excitatory or inhibitory. It depends on that subclass of receptor that predominates at the target organ. So if in fact, class, it's here, meaning the adrenergic receptors bind with norepinephrine or epinephrine in the arteriolar, it will cause vasoconstriction. It will cause arteriolar vasoconstriction, class. On the converse, if in fact, class, it would be those beta receptors that predominate, it will cause vasodilation, class, of the skeletal and cardiac arterioles. So it's important to know, class, what receptors predominate in each of those places. So next up here, class, I have examples. For example, norepinephrine, class, by way of the beta-1 receptors at cardiac muscle, it increases heart activity. Heart activity becomes quite vigorous. To contrast that, epinephrine, class, with the beta-2 receptors at the bronchiole, it causes the smooth muscle there, class, to relax, dilating the bronchiole. Class, I will ask you about this on your test. Please listen to this and take, I'll say, amazing notes. I'll continue on, class, here. So this class shows pretty much what I just did with you all. I say if you need this class, please pause. But it does, class, indeed review what we've just done. Here, class, it gives you drug classes such as nicotine, meaning it states here, in the event, class, that a person takes nicotine, it's applied, class, at least in the clinic, to, of course, help someone stop smoking. I'll move on to acetylcholine esterase inhibitors. There's a drug for that. And an example of the class is sarin, meaning it's used widely, of course, meaning similar to this, as an insecticide. Yes, it kills insects. But it was also used in times prior, class, as a chemical warfare agent. And yes, people did die from such. Albuterol, class, has been used for someone who's asthmatic. It dilates the bronchioles by binding to what I just mentioned, class, those beta-2 receptors. Next up, class, is phenylephrine. Yes, I did say it, phenylephrine, class. You've heard of phenylephrine. If you haven't heard of it, class, go to your neighborhood pharmacy on the corner of Happy and Healthy. Look in the store, class, and get some wall drill if you would like some. If you're able to buy it. If you're not able to buy it, don't you go buy that stuff. But as it states, class, it's used, class, for colds. It's a nasal decongestant because it binds, class, to your alpha-1 receptors. Important to know this stuff, class. And even, class, the propranolol. The propranolol. So it's used, class, as a hypertensive drug, meaning OLL are beta blockers because they block the beta receptors, class, decreasing blood pressure. I'll get to this, class, here shortly. I'll now continue. So now, class, I've already mentioned dual innervation. So keep on, class, with this and review on your own. But what I haven't yet done, class, is I'll just say that dual innervation, class, is not always the case. That's where I'm going right now. Dual innervation, class, is not always the case. I've mentioned this once, but I'm saying it again. So I'm saying it in this way is because all arteries and veins, meaning those blood vessels, are innervated by the sympathetic nervous system with absolutely, class, no, I repeat, with no parasympathetic innervation. So that's meaning the diameters, class, are regulated by the sympathetic nervous system. So as I've stated this, we also have this dynamic antagonism, class, which allows for that precise control of visceral activity. So your sympathetic nervous system, class, is what increases heart rate and respiratory rates, and then inhibits digestion, class, and elimination. For instance, as I run, class, there is no way I could just go through and digest food. So that's why you may have said, I'm going swimming today, and you did not, class, eat right before you swam. Because as you swam, class, you would not have been digesting, class, your, I don't know, what did you eat? Your salad, or your hummus, or even a hot dog, so to speak. Yeah, grilled hot dogs are the best. The parasympathetic division, class, is what decreases the heart rate and, of course, respiratory rates. And then it allows, class, for you to do what? Rest and digest, meaning to digest, class, and discard of wastes. I don't know when you've gone, class, but you should go at least once daily. And when you do go, class, I would know for a fact, because it is physiological, that you must, class, I guess I'll say, not just rest, but also relax, class, to, of course, discard of wastes. Again, class, this is my, I think, 5th time saying this. Almost all blood vessel smooth muscle is entirely, class, innervated by sympathetic fibers only. So this division, class, controls A, blood pressure. There is no B. Even, class, at rest. Let's get to now what is called vasomotor tone, or sympathetic tone. Here it is. So I say, we have what are called continuous sympathetic impulses, class, which cause us to exhibit sympathetic tone, or vasomotor tone. So it's that increase in sympathetic stimulation, and it increases, class, blood pressure, causing vasoconstriction. Class, this is important. So if blood pressure drops, the sympathetic fibers fire faster than normal to increase constriction class of blood vessels and cause blood pressure to rise. So if blood pressure rises, the sympathetic fibers fire less than normal, causing less constriction, i.e. dilation class of blood vessels, which leads class to the decrease in blood pressure. So this is what allows class, the sympathetic nervous system class, to shunt blood wherever you need it. So with this class, we also have involving the parasympathetic nervous system. So in contrast, we have the parasympathetic effects. So here, I'll say it as meaning the parasympathetic effects, they normally dominate the heart. I'll say again, in contrast to what I just gave you class about sympathetic tone or vasomotor tone, the parasympathetic effects normally dominate the heart and smooth muscle of digestive and urinary organs. Look at that. In other words, class, your heart rate should be sitting at what is called 200 beats per minute. If you're at 200 beats per minute, class, it's called tachycardia, and that is not good to be tachycardic. So with that, the sympathetic division class, well, let me slow it down. So the parasympathetic division class, as it states here, it dominates the heart and smooth muscle of your digestive and urinary tract organs, and it activates class most glands except for the adrenal and sweat glands. Now you say why? I mentioned earlier class that they are innervated class by the sympathetic nervous system. So having this way, class, this is what slows the heart and dictates, class, the normal activity levels of the digestive and urinary tracts. So this is why your heart rate, class, ought to be at an approximate 75 beats per minute. I say ought to be. If you happen to be a runner, class, it may be lower. If you happen to not run, it may very well be higher. Yeah, I'll just say it like that. So this class, of course, is why these organs exhibit what is known as parasympathetic tone. In some cases, class, I'll say it, the sympathetic nervous system can and will override in stressful situations. So it would increase, class, the heart rate and cause, class, fecal and urinary retention. I can't say it any way other than that. So drugs that block the parasympathetic responses, class, they do indeed increase heart rate and cause fecal and urinary retention. Now on to cooperative effects. Look for the test, class. So this class happens in the external genitalia. So by way of the erect class clitoris and the erect penis. So it's because, class, parasympathetic stimulation that dilates the external genitalia and blood vessels. And of course, it may also be why, meaning be that exclamation class for why anxiety class can impair sexual performance. So it's the sympathetic nervous system that's in charge, class, in that case. With sympathetic stimulation, class then causes ejaculation of the penis and the reflexive contractions, class, of the vagina. There it is. So here we are, class, with unique roles. I say again, here we are with unique roles of the sympathetic division. First things first, it says the adrenal medulla, class, sweat glands, reticular muscles, the kidneys, class, and almost all blood vessels receive only, I can't say this enough, class, only sympathetic fibers. Write that down, class. Know this not just for your test, but know it for life. So other unique functions, class, look for this in your test, are thermoregulatory responses to heat, i.e., when body temperature, class, rises, your sympathetic nerves, class, causes us to, of course, A, activate sweat glands, and B, it dilates skin blood vessels, allowing heat to escape. And in the event, class, that body temperature drops, those blood vessels, class, will constrict. I'll get to, class, the metabolic effects now. So this class allows you and allows me to, of course, metabolize fats, class, for use as fuel. It also, class, raises blood glucose levels and increases the metabolic rate, class, of our cells. And nextly, class, since we've done the prior two, I'll get on to what is called the release of renin, class, from the kidneys. So this states, class, that the sympathetic system causes release of renin from the kidneys, class, that in turn activates a system that increases blood pressure. On your final exam, class, again, I'll say it, class, on your final exam, you all will be tasked with explaining, class, that system that becomes activated. And that system, class, is called the renin-angiotensin-aldosterone system, or mechanism. I'll say this yet again. On your test, class, you all will be tasked with explaining what occurs when it is activated. What is it, class? It's called the renin-angiotensin-aldosterone system. Let us begin. Class, if you have ever written notes, I would say now's the time to begin to write notes. I'll give you just a moment. If you don't have a moment, please click pause. Let us begin. If you want to know what's happening here, it's this system that is, I say again, under control by way of that sympathetic nervous system. So I'm stating this because it says there, kidneys. The mechanism as is begins with a decrease in either of the following three. Let us begin. I'll be here in the middle, in green. So the following three could be a drop in systemic blood pressure. It could be a decrease or drop in sodium ion concentration. It could also be a drop or at least decrease in blood volume. Any of these three would cause from the kidney, by way of the juxtaglomerular cells, to secrete renin. I say again, the juxtaglomerular cells of the kidney would secrete renin. As soon as that occurs, that enzyme renin would then convert angiotensinogen into angiotensin 1. So as I say this, it's in response to our renal baroreceptors, if it's in the resulting drop in blood pressure or blood volume, or even class, it would be a decrease in sodium. So as renin causes angiotensinogen, which is in the liver normally, to convert into angiotensin 1, what happens thereafter would be that the angiotensin converting enzyme, also known as ACE, will convert angiotensin 1 into angiotensin 2. As that occurs, it causes a four-fold response. First things first, it causes vasoconstriction. It causes the secretion of aldosterone. And this happens by way of those adrenocortical cells. And this happens by the adrenocorticotropic hormone. What happens with aldosterone is this causes the kidney to conserve sodium ions and water via osmosis, and it increases the potassium ion secretion. Next up, it causes antidiuretic hormone secretion. It's also known as ADH. What ADH does is causes, of course, the reabsorption of even more water. It's called the antidiuretic hormone. So this hormone, also known as vasopressin, is integrally important class for your health. The fourth and final, fourth-fold effect, is increased thirst in him or her. Now you may wonder, why have I gone through this in such a way? The reason I have done this is because every one of these, meaning the first thing that I got to was a vasoconstriction. So here it is, vasoconstriction class of the systemic arterioles, which increases peripheral resistance, i.e. it increases blood pressure. If you can't tell, it's right there in pink. That's one way. The second way class I mentioned was aldosterone secretion by way of the adrenal cortex. Well, from that happens, I say again, it causes sodium to be reabsorbed. Hello! Water always follows salt. That's the reabsorption of water. That increases your blood volume. By increasing blood volume class, it also causes an increase in systemic blood pressure. We're 2 for 2 right now. Up next class, I mentioned that it's going to be the secretion class of the anti-diuretic hormone. ADH class, of course, causes the reabsorption of even more water. In other words, class, that, of course, increases blood volume. That's 3 out of 3. And the fourth and final one, class, I said, was increased thirst. Every single one of these, class, increases blood pressure. And one thing I almost forgot to mention, class, as I got to the angiotensin converting enzyme converting angiotensin 1 to angiotensin 2, is that angiotensin 2, add this to your notes, class, is a powerful vasoconstrictor. So yes, it also increases blood pressure. So these are 5 different ways, class, that the renin-angiotensin-aldosterone system increases blood pressure. On your test, class, you'll explain every piece and part of this. And I'm saying this because it's this system, class, that is likely the cause of a number of people, class, being on, I guess I'll say, this drug or that drug to counteract the effects of this system. Having said this, I'll get to one more thing, class, to add to it. And if you're wondering where I'm going, give me just a moment to get there. Where I'm going, class, is autonomic disorders that involve deficient control of smooth muscle activity. Here it is. Hypertension, also known as, class, high blood pressure. In case you missed it, class, we just got to this in a roundabout way, likely by way of that renin-angiotensin-aldosterone system, meaning everything that, of course, is an effect of that contributes, class, to hypertension, meaning that overactive sympathetic vasoconstrictor response, meaning the heart works harder, the artery walls, class, are subject to increased wear and tear, and, of course, this can be treated. So let's get to, class, treatment. I'll give you, class, 4 classes of drugs that act to counteract on and maybe, of course, treat someone's, of course, hypertensive activity. This is 2, class, on your test. So the first type, class, are the prils. That's a suffix, class, pril, P-R-I-L, the prils. So the prils, class, are known as angiotensin-converting enzyme inhibitors. You may have heard them on television, class, by way of a commercial called the ACE inhibitors. So what ACE inhibitors do, class, is a block formation of angiotensin 2. We just got through this. So by preventing, class, vasoconstriction and sodium retention, meaning they would stop, class, the entire renin-angiotensin-aldosterone system by blocking, class, the formation of angiotensin 2. Up next, class, will be the beta blockers, the OLOLs. They are beta blockers, the OLOLs. What they do, class, is lower the heart rate and reducing contractility, class, by blocking the beta adrenergic receptors, class, on the heart. Next up, class, are the calcium channel blockers. They are known, class, as the pines, P-I-N-E-S. What the pines do, class, is they cause dilation, class, of blood vessels by keeping calcium ions out of smooth muscle cells in the vessel wall. Up next, class, are the diuretics. They're called Zydes and Mides. That's Z-I-D-E and M-I-D-E. So what they do, class, is increase urine output. And you say, why, Huff? Well, the reason it happens, class, is by increasing urine output, they lower, class, blood volume. Class, on your test, I will ask about this. It is hypertension. It's that persistently elevated arterial blood pressure, class. So kidney disease, class, can also, of course, be an issue here. And definitely, class, I just mentioned the angiotensin 2, which, of course, causes the release of aldosterone. So please note this, class, and be able to explain every bit of this on your test. So to get back, class, to where I just left off. So I was looking at this here, the parasympathetic division, class. It states that it tends, class, to elicit those short-lived and highly localized control over those effectors. So, of course, acetylcholine is quickly destroyed by, of course, acetylcholinesterase. However, the sympathetic nervous system, class, that division there, tends to be longer-lasting with body-wide effects, meaning norepinephrine, class, is activated more slowly than acetylcholine. And norepinephrine, class, as well as epinephrine from the adrenal medulla, class, have what is called prolonged effects, even after those signals, class, to the parasympathetic nervous system have ceased. So I won't go through all of this, but I will look at some of this. The blood vessels, of course. What happens there, it states, is it constricts, meaning what happens here is the sympathetic effects on blood vessels, it constricts class most blood vessels, and it increases class blood pressure. We just went through this class. It constricts vessels of the abdominal viscera and skin to divert class blood to muscles, brain, and heart when necessary, to shunt those things called blood. But epinephrine class weakly dilates the vessels of skeletal muscles during exercise. And looking here, class, where it says kidney, we've done this moments ago, with promoting class the release of renin, causing a vasoconstriction, and of course, it decreases urine output. I'll now continue. So autonomic class neuropathy will be damage class to those autonomic nerves, and this particularly is a complication class of diabetes mellitus. I'll continue on, class. So the autonomic nervous system class is under control by the central nervous system the central nervous system centers, We did part of these yesterday, class, in our prior lecture. In other words, well, not yesterday, but in our prior lecture. The brainstem, the spinal cord, the hypothalamus, and the cerebral cortex class. So keeping in mind, class, that the hypothalamus is, of course, that main integrative center of autonomic nervous system activity. And, of course, cerebral input class may modify the autonomic nervous system, but it does so, class, subconsciously. So with everything we've done here, class, keep in mind that the brainstem and spinal cord does control, class, the reticular formation with direct influence over the autonomic nervous system. The medullary centers, class, regulate heart rate and blood vessel diameter, as well as the gastrointestinal activities. The midbrain class controls the pupil and lenses. I hope you all do remember that. And the spinal cord class controls defecation and micturition, but are subject class to conscious override. In other words, you can stop going here and there because, of course, you know that you're still sitting, I guess, on a chair and not class at the toilet. So hypothalamic controls class. What is here? The centers class are heart activity, blood pressure, temperature of the body, water balance, and endocrine activity. Also class emotional responses such as pleasure, rage, and fear through class the limbic system. The cortical controls class here, the voluntary cortical control of some visceral activities. So awareness class of our physiological conditions to constantly class influence them, to consciously, influence them. So biofeedback training allows some people to class control migraines and even manage stress. I won't get into either of those now. So there it is, class. This is what we just went through with those levels of autonomic nervous system control by way of our brain. So we've done class hypertension. Next up, class, is Raynaud's disease, another class disorder of the autonomic nervous system. So this is a painful class, exaggerated vasoconstriction class of the fingers and toes. So it's treated class with vasodilators. And of course, it says the digits turn pale and then become cyanotic class, meaning they become blue because of the lack of oxygen. And last of which will be autonomic dysreflexia class. This is that life-threatening, uncontrolled activation of the autonomic neurons class in quadriplegics and people class with spinal cord injuries above thoracic class number 6. So blood pressure class skyrockets, and of course, this may cause a person class to, of course, experience a stroke. So having done this class, what I'll say is please make sure you all review this lecture and take notes on this lecture. A number of questions, class, on your lecture test will come from this lecture. Prepare well for the test, class. Let me know if you have questions by way of course, email, telephone call to the office telephone number, or even class before or after class. Thank you all as always, for listening. This has been your instructor, class, Scholar Huff.